Hi, my name is Latasha Griffin and I'm a family nurse practitioner. Today we're going to be talking about fentanyl, the America's new drug killer. Let's get started. So fentanyl is called the silent killer. What is fentanyl? It is a powerful synthetic opioid that is similar to morphine, but it is 50 to 100 times more potent. It is a prescription drug that is also used illegally like morphine. It is a medication that is typically used to treat patients with severe pain, especially after surgery. It is also sometimes used to treat patients with chronic pain who are physically tolerant to other opioids. So how do people use fentanyl? So when prescribed by a doctor, fentanyl can be given as a shot, it can be given as a patch that is put on a person's skin, or lollipops. The illegally used fentanyl, most often associated with recent overdose, is made in the labs. This synthetic fentanyl is sold illegally as a powder dropped onto black paper or put into eyedroppers and nasal sprays. They are also made into pills that look like other prescription opioids. How does fentanyl affect the body? Fentanyl is similar to other commonly used opioids, analgesics such as morphine. But when you take fentanyl, it gives you this euphoric feeling. It also helps with pain relief. It causes you to relax. It can sedate you. It can cause confusion, drowsiness, dizziness, nausea, vomiting, urinary retention, and pupillary constriction. Drug deaths in America are rising faster than ever. The number of drug overdose deaths increased by nearly 5% from 2018 to 2019 and has quadrupled since 1991. Over 70% of the 70,630 deaths in 2019 involved in opioid. From 2018 to 2019, there were significant changes in opioid-involved death rates. From 1999 to 2019, nearly 500,000 people died from an overdose involving an opioid, including prescription and illicit opioids. Can you overdose on fentanyl? Absolutely. And this is because most opioid use is the illegal kind. It is impossible to know how potent the dosages are and what has been mixed with it. Some drug dealers are mixing fentanyl with other drugs such as heroin, cocaine, methamphetamines, and MDMA. This is because it takes very little to produce a high fentanyl, making it a cheaper option. So this is especially risky when people are taking drugs and they don't even realize they might contain fentanyl as a cheap but dangerous additive. They might be taking stronger opioids than their bodies are used to, which can cause them to more likely to overdose. So what do we do if you know someone who's on opioids or using opioids? There is a treatment for overdose treatment, and if you are taking opioids just because it's related to your surgery, if you had your tooth extracted or anything that has a narcotic opioid in it, it is very important that you do have this medication called naloxone at your home, because you never know if someone you know can overdose on it. So naloxone is a medicine. It's also called Narcan too. It can treat fentanyl overdose when given right away. It works rapidly by binding to the opioid receptors and blocking the effects of opioid drugs. Fentanyl is stronger than any other opioid drug like morphine, and it might require multiple doses of this medication. One pill can kill. Hydrocodone, methadone, oxycodone, fentanyl, morphine, codeine, hydromorphone, and acetaminophen. These are all drugs that can kill if they are laced with fentanyl. Let's talk about prevention. Before receiving a prescription for an opioid drug, ask your prescriber, is there any other effective non-opioid treatment that they can prescribe you? Make sure you follow your medication instructions carefully. Store your medications in a safe and secure location away from children, pets, or anyone that is most likely to abuse those medications. Do not take opioid medication with alcohol, illegal drugs, or any other medication that can affect your breathing. As a general rule, you should never purchase or ingest medication or prescription drugs that come from a private person. You do not know where they got that medication from. You don't know if it's laced with any fentanyl, okay? Make sure your pills match the description listed on the prescription label of the container, or it is a sealed package. If you're uncertain about any medication, always contact your doctor or your pharmacist before taking. As the death tolls from the nation's opioid crisis swells, California officials have launched an experiment. They're paying for people to test their drugs for fentanyl. These test strips are called rapid response. You can test these. You can test your urine before taking the medication, and then you can test your urine to see if there was any fentanyl in it. We do recommend you test the medication before you take it to prevent accidental overdose. Increasing public awareness about prescription opioid misuse and overdose, and to make the safe choices about opioids is a public awareness. Collaboration is essential for success in preventing opioid overdose deaths. Medical personnel, emergency departments, first responders, public safety officials, mental health, and substance abuse treatment providers can all bring awareness and resources and expertise to address this complex and fast-moving epidemic. Together, we can better coordinate efforts to prevent opioid overdoses and deaths. Some of the community resources that you can reach out to is the California Department of Public Health, California Healthcare Foundation, California Department of Healthcare Services, your local law enforcement, your local medical providers, and your local mental health and chemical dependency treatment centers. If you know of anyone who is struggling with drug abuse or substance abuse, here's a number that you can call. It is a 24/7 hotline. The number is 1-866-799-0923. Take care, be blessed.